All right. So it's 8 o'clock. I think we'll begin on time, as we like to do in the yoga world, to respect everyone's time. So welcome to our second event for the Yoga Therapy Book Club. And I'm very excited about it, very honored to be interviewing these two wonderful authors and teachers. And tonight we're gonna, we're still a work in progress. So if you have any feedback, we'd be really happy to hear from you. The feedback we got is that we wanted a little more interaction, and so we're going to do that. So I really want to invite everyone as we talk to put questions in the chat, especially if you've read the book and you have specific questions for Lee or Ananda. It's a really unique opportunity to have both of them here. Lee is joining us from Toronto. Yes, I'm correct. And Ananda is joining us from India, from Pondicherry. And I am joining you from Israel. So we're really an international group all over the world, and I'm sure people from all over the world are joining. So it's a really unique opportunity to hear the authors' voices and to have them be able to answer your questions. So feel free to post questions in the chat. We'll keep everyone muted for the first part, which is the interview. We'll have an interview for about 45 minutes, where I'll ask Lee and Ananda questions about their book, and they'll share experiences and stories. And then we're going to open it up for questions. And the ones who put it in the chat, we have someone monitoring your questions, and we'll ask as many as we can. And we have a good 30 minutes, at least maybe 40 minutes for questions. So we'll use the time to get to know. Just so you know, we'll be recording this meeting, but we will not be recording the questions and answers. So on the recording, it will just be the three of us, and the questions and answers are just for the people who come live to the events, who have the opportunity to meet the authors. Okay? So without further ado, I'm going to introduce Lee Majewski and Ananda Balayogi Bhavanani. I'm going to invite them to just say a couple words about themselves, just for a minute or two. And then Lee is going to lead us in a centering. So we're going to also have a few more practices. We're going to begin with a short practice, and we're going to end with a short practice as well. So Lee, would you be happy to introduce yourself?
Well, I'm Lee Majewski, and I am yoga therapist, CIOY certified, but I am also certified by Indian Yoga Associations, and I was honored by Ananda's lineage to be called Yogacharya, and I see it as a very high honor. I have a private practice at home, which I do on Zoom, and my experiences mainly are with cancer and non-communicable diseases, and I created a 3-week retreat, residential retreat, from which most of my experiences are coming, which are also included in the book. And I'm old. Probably oldest in this gathering, but I still feel 40. So that's me. Now, Ananda, take it over.
Namaste and greetings from this part of the world where it's about midnight. But I'm happy to stay awake and be with all of you and have this beautiful session, especially because Lee and I go back many years, and I always call her my Canadian mom. So it's nice to be with my Canadian mom, and we have had beautiful opportunities to work together that then resulted in the book and many other such events. I was born into a yoga family. I consider it a very great fortune. And because I know that with great fortune comes great responsibility, I try to share it as best as I can with my experience both in yoga. My experience in yoga is my age plus 9 months in my mother's womb, and of course, modern medical training. So I continue as professor and director of an Institute of Salutogenesis, about which I'll talk later, where we have one of the few schools of yoga therapy and schools of music therapy in a medical healthcare university. So looking forward to sharing a lot as we go on. And thank you everyone for being part of this wonderful event.
Thank you so much. So, Lee, would you care to start us out with the centering?
Yeah, why don't we close the eyes and drop in and notice what's happening with your physical body. Notice any stresses. Don't judge. Don't go into I don't want to. But just notice what is happening in your physical body. And if you feel any stress in any part of the body, breathe into it. And then you can move to noticing, being aware of your emotional body, any feelings or emotions that you bring into this setting with you. Just notice. No judgment, no stories around it. Just noticing what is. And finally, notice what kind of energy are you bringing into this setting. Is it Rajas? Is it Tamas? Is it Sattva? Just notice. Again, no changes, no stories around it. Just what is. And I will play a little gong about 3 times. And as you will hear the sound diminishing, there is a notice the pause between the silence and before your mind starts working with the thoughts. Before, notice this the diminishing sound, and then there is a moment of silence before your mind starts thinking. And when you notice it, I want you to notice also, how does that feel? Two more times. And the last time. And now you can take a deep breath in, and when you're ready, you can open your eyes and come back to the Zoom room.
Well, thank you so much. So I'm going to begin by really asking you an important question. We're going to introduce the book that both of you wrote, Yoga Therapy as a Whole Person Approach to Health. But why did this book need to be written? And why does the world need this book?
Oh, I will answer the first one, but I'll leave the second one to Ananda. When I was living in Kevailadam in India, it became apparent that you have spirituality in the air in India, like it's everywhere. It's a part of the life. Whereas here out west, we have this aversion to spirituality because we connect it with religion, and we think that in society generally we think that yoga is asanas, right? So it was very apparent, and this thing grew in me inside, that there needs to be something out there that talks about yoga therapy as the whole thing, not just asanas. And, and that it needs to be talked about and discussed as widely as possible. And then I thought that, it is also important that we include the voice from India. And I couldn't think of anybody better than Ananda. By then we had, he wrote a couple of papers on the work that I was doing in Kevailadam. So he knew, and then we found out that we have the same attitudes and we think almost the same things. So I thought that would be the fantastic addition to the quality of the book. Honoring where the yoga roots, where the yoga is coming from. And the second question Ananda is going to answer.
Well, I think the most important part of the whole book is that often yoga therapy becomes piecemeal approach. We often forget we are dealing with a living being, aspirational living being. We often forget that yoga is not just for the physical body, and that is why this whole person approach had to come together. And the work we did at Kaivalyadharma, the writings we did, the exchanges we had, made us realize that there was enough of reductionist approach, and that there had to be something out there that also gave another perspective, which was whole person. Now, if you look at it from the modern yoga therapy perspective, we have adopted, for better or worse, the modern medical approach. So we want to use the diagnostics of the modern healthcare. We want to have the insurance support of modern healthcare. We want to use the facilities, the language, the methodologies. And in doing that, what has happened is yoga therapy often becomes therapy without the bigger yoga perspective. And this is why, as said in the IAYT, perspective, keep the yoga in yoga therapy. I think that is one major thing we have tried to do in this book is make sure we are keeping the yoga in the yoga therapy.
Yeah. And that we're not talking yoga for cancer.
Exactly.
We're talking about yoga for patient with cancer. Yoga
In,
for human being with pathology.
in fact, I would like to add, thank you, Lee, for that. You know, the father of modern medicine is said to be William Osler. And William Osler has made a statement: the good physician treats the disease, the great physician treats the person who has the disease. But modern medicine, we often forget that. And I want to make sure in yoga therapy, we do not forget the whole person.
I think that's very, very important. Thank you for sharing that. Um, I'm going to jump to a later question because I think it's really relevant now. And something that I've been struggling with is that how do we do this? How do we, because I know you have a hospital, a medical center, which seems ideal for yoga therapy, but it's been, the hospital was built around yoga therapy and music therapy being a part of it. How do we do this in the modern healthcare system? Is it possible? And in a perfect world, what would be your vision of yoga therapy within the healthcare system that exists now
Yeah,
in the West?
yeah. You see, the reason I went into medicine was that we wanted to bring about this exchange of ideas between the tradition and the modern. So, having been trained in modern medicine and knowing the language of modern medicine, I think it has helped me personally in being a human bridge between yoga and modern medicine. Because, just giving evidence based papers will never convince anyone. In fact, you can never convince anyone by logic, you can never convince anyone by fact. And this is where we need human bridges. And so in my life, I have found myself to be a human bridge. I have been creating many human bridges in my own students who understand modern medical approach, they understand the traditional yoga approach and communicate it. The biggest drawback is lack of communication. So on one side, the modern medical doctors saying yoga doesn't do any good. We need more randomized control trials. We need meta-analysis. They'll keep on asking you for more. Okay, because fact, logic will never make the difference. The way you make the difference is get them into the yoga session. This is how you make the difference. So when we got an opportunity to be part of a healthcare university, which is hardcore allopathy. We have 2 medical colleges, a nursing college, dental college, physiotherapy, pharmacy, allied health, and about 1,500 students. All of them get an elective in yoga. All of them get an elective in music therapy. So right from the beginning, when they come into the professional life, we are making them brand ambassadors for this holistic approach. With the doctors, the nurses, the administrators who are already there, we get them into sessions. It could be in a conference, it could be in a workshop, it could be a Saturday morning session for the administrative staff. Any place you get an opportunity, get them to have a feel of yoga. This is not white papers. This is not government decisions. Get the healthcare professionals, get the administrators to have that feel of yoga. Once they have the feel of yoga, they will be on your side. And then they will facilitate it. Then comes working with the people who are admitted in the hospital. We started off with psychiatry. They were the first department to say, can you come and help us? Because whenever anybody doesn't know what to do with the patient or client or the care seeker in the hospital, they send them to psychiatry. It is the, recycle bin of the hospital. And in our hospital, the recycle bin of psychiatry is yoga therapy. When they don't know what to do with people, they send to us. So that is where we started it. I remember the first few patients who came and had a session, next day came with the entire ward. The entire ward came because they said, we want what that person got yesterday. That is how you build trust. Then you start to work. Our dean, he was an anesthetist. He had neck pain, back pain, couldn't do his job, came to us, got rid of his neck and back pain, and became our full-hearted supporter. So this is what we need to do. People are always thinking policy decisions. They are thinking government letters. No, we individual yoga therapists can make the difference by going into healthcare, offering the experience of what yoga can give the person, and that changes the difference. This is how we have approached it. And today, 15 years later, we don't have to go to the department. They come to us. We do not have to say we want to do research studies. They will come to us. An MD in general medicine will do a yoga topic for his thesis. A pediatrician, when she's studying her MD pediatrics, her thesis was on a yoga-based topic. An orthopedic surgeon takes a topic on yoga. A nursing professional, a dental professional. These students now come with the guides. They come with the professors saying, can we do collaborative work with you? This is how you bring the change. 15 years. 15 years it takes. Doesn't happen overnight.
No, and
Wow.
I think the gist of it is that we in the West are used to learning by understanding. We are not used to approach the learning through experience. And that is the gist of the difference. So when I was running the 3-week retreats, I would not explain anything about yoga to people who never did yoga before. I just asked them, please just do the practices. And they would do 6 hours of practices every day. And suddenly at the end of the first week, they would come and they would say, oh my God, what happened? I felt this and I felt this and I feel so much better. What's going on? Then, only then, when they are open with experience and not understanding what the experience was, were they open to explanation of whether philosophy or yogic functionality or autonomy, but it wasn't, this is how it is. No, it was answering their questions. They were open then through the experience. Experience has to come first.
So what advice would you give to our yoga therapists who are here who are struggling to break into the healthcare system or break into new job opportunities?
Well, I think the first thing is you have to use the camel in the tent approach. Okay?
Okay.
Camel in the tent approach is always the best approach. Get a foot wherever you can get it. See, the idea what we have is we want the hospitals to first create a yoga therapy department, create a position for a yoga therapist, and then we will go in. It will never happen that way. If there is an opportunity for a research study in a hospital that you know of, in a healthcare university that you know of, get into that. Research is where they all are going now because there's a lot of money coming into it now. So they will have positions for research. Try to get into that. Start to show the impact of yoga therapy in their research subjects. That will build confidence. And again, you don't have to be in the biggest hospital. It can be, the local practitioner, where you can say on a Saturday morning, can I offer stress-based, relaxation through yoga for your patients? And how do you market it? You tell them yoga is the non-pharmacological relaxation. Non-pharmacological relaxation is yoga. This is the marketing part. Because all doctors today, all healthcare professionals, they know that relaxation facilitates healing. Relaxation facilitates healing. But they don't know how to get the care seekers to relax. If you give an anxiolytic, you have already made them dependent. If you give them an anxiolytic, you have to increase the dose as it goes on. Everybody is looking for a non-pharmacological method of relaxation, and you start to market it that way. Once the people start getting the taste, again and again I come back to that taste, they will ask the doctor, I would like to have a bit of that. So this is how it has to happen. We are waiting for a top-down approach. Top-down approach, even in India, doesn't work. Now the government supports yoga therapy, not before. It is bottom-up approach that is making the biggest difference that I find.
And the other part of it also is be prepared for a great resistance. In Canada, it ain't gonna happen first time you approach it. I worked with UHN, which is University Health Network, which is, I think they have 5 or 6 hospitals. In that, they have cancer hospital where I was a patient. And I was trying to get them to do research. And what I found, it took me 3 years to find out, and they were telling me, yes, we will do research, blah, blah, blah. But what I found out was that this particular institute, which is top, I think it's in the top 3 cancer institutes in the world, is heavily funded by pharmacologic
companies,
industry, right? Yeah. And there was no way in hell that they would allow for research in yoga. They were only financing their own stuff. So I decided I'm going to give up this way. However, what I discovered was that, and you may try to find out, that they had a health and fitness center which was providing health and fitness programs for UHN staff, for doctors and nurses, administration, everything. And I got my foot in there with yoga. So, if the door is closed here, you can try to find another door. But they were actually very, very receptive. Those classes were very, very good. And I would still continue, except I went to India. Anyway. So
thank you.
So it ain't easy. And it's going to take persistence. And, I gave up because I thought I'm too old. I'll leave it to other young folks to fight this battle. Because you talk 3 years and you end up, instead of research, we started with a research paper. You end up just doing a little program, video program, which they're not using even.
I think persistence is vital. In fact, persistence is the key in this. And, people think in India it's easier, though we have the cultural support. At the same time, our Indian doctors are often more against yoga than even Western doctors. So, it's sort of, they get indoctrinated very strongly. But again, the biggest advantage is when their care seekers come back showing improvement. That is what changes the perspective of the healthcare provider. And we have had people who have come to us, phoned us, emailed us saying, this patient of mine was not responding. We had a patient of psoriasis not responding to drugs. When we started the yoga therapy, she started to respond to the drugs better, and the doctors opened up the whole dermatology ward, and now we have a PhD completed on yoga in dermatology, one of the first in the whole world. It started with one person, non-responder, becoming responsive to the drug. So we are not saying yoga is an alternative to modern medicine. This is where integrative medicine, complementary medicine is to be facilitated, not alternate. The moment you say alternate, it is you or me, and you are on the back foot already. We
Yeah.
work together. So in our hospital, how we project both yoga therapy and music therapy is as adjunct therapy to the therapy being provided by the hospital. We are not replacing the modern medical management, we are adding to it. And this actually takes away that survival instinct, resistance, fear, that what if you run away with my clients? We are not going to run away. We are there to support you. We are team. I think this type of communication is vital because too many people on either side take on an antagonistic approach and create problems for people like me who have one foot in yoga, one in modern medicine.
Amazing. Thank you so much. I want to talk a little bit about some new concepts that I believe you guys bring out in your book. Some really important concepts. The importance of sadhana, number one, from misnomer of self-care to understanding it is a core competency through expanding our personal awareness and consciousness. Can you expand on that?
Well, that is my PV. That is what I believe that we in the West have not stressed enough and understood enough that our own development is the most important of being a professional. And our own development doesn't end with 2 or 3 years of yoga therapy course. That development is going on as long as we are calling ourselves yoga therapist, and as we work with that. So many times I heard people saying yoga, meditation, and pranayama. The same thing, right? Yoga is this, and it is our luck, and it is something that is so precious to be able to do this, to practice every day, and to be able to take the veil off our eyes and start seeing the world as it is. Start seeing our clients the way they are, presenting themselves. If we don't do this, we're not professionals. You can't learn. I shudder when I hear that I did yoga online, course yoga online. And then IYT now allows for learning yoga therapy online completely. To me, it's just like, I don't understand that. We're not yoga therapists if we do not have everyday sadhana, if we do not work on ourselves. That is the fact, and this is, I think it's going to be my next book, my next book, because the fact that the one person is, the mentor is influencing the energy of the student is totally unknown in the West, completely disregarded. And so having you on the screen is not a substitute to having you sitting next to me and influencing my own subtle energy. When I was with Guru at the beginning, just a little anecdote. When I was in the ashram, I went to ashram for 3 weeks and I stayed 3.5 years. I went to India for 9 months and I stayed 6 years. So, but when I was Guru, I didn't know what Guru was, but I was working for him and with him, and I had to have his decision about certain things every day. So I would go to him with a list in my head of questions that I needed to answer from him to decide which way things were to be gone. Well, everything was fine until I came to his presence, and suddenly there were no questions. And it didn't happen once. It happened constantly. And I said to him, what the hell is happening? So I said, I have those questions that I need answer from you, but when I come to your presence, there's no questions. And he explained to me. So first of all, he said, why don't you write it down, bring it to me, and then I'll say yes, no, or maybe, and so forth. And then he explained to me that we are in subtle energy like a magnet. The more organized and the stronger energy organizes the energy of the person next to you. And so when I came into his proximity, his energy organized my energy, and there was emptiness in my head. Beautiful emptiness. I just wanted to sit. I didn't want to do anything. I just wanted to sit there. Now, we don't speak about that in the West because we don't have gurus. We don't have that whole tradition in the India had its background and roots and sense. We want to learn from the screen. And to me, it's just unbelievable that IYT would approve that. Anyway, sorry, don't get me on that because that is really something. Okay, Ananda, you take over.
I was just enjoying listening to you, and I thought I was the only gangster yogi around here, but I think my Canadian mom is also another gangster yogi. Sadhana is a focus on the higher reality. And Ammaji, my beloved mother, who along with Swamiji, my beloved father, always hold my back, she used to say, Sat Dharana, to focus. Dharana is to focus, contemplate the Sat, the highest reality. So in our life, we are often caught up with the mundane realities of, taking care of the body, taking care of the house, the people with whom we are, hanging on to a job, getting the transport so that we are not late where we have to be. We are always caught up with the mundane. We often lose sight of the bigger picture. And if we lose sight of the bigger picture, we will become stressed. Because as long as you focus on the small picture, you will always be stressed. So I suggest to people always get your nose out of the mud, because if your nose is in the mud, you will smell, taste and feel nothing but the mud. When you come up into a standing position, your perspective changes. You get into the tree, like I used to do as a child, enjoyed climbing trees because the perspective is so much wider. Climb a mountain, it's even wider. Get on a drone, it is even wider. And then elevate yourself into satellite perspective. The satellite perspective, where you understand the linkage between each and every part of your own life. That is sadhana. How do we do it in yoga? We work with the body, develop awareness of the body. You cannot lie to yourself because you know whether you can touch your toes or not. The problem with us going into all these deeper meditational practices is you can always swindle yourself, cheat yourself by saying, I am in samadhi. Patanjali calls it Bhranti Darshana, an illusion of the subconscious, unconscious to prevent you from keeping on the path. So do your asanas, do your physical practices so that you are aware of what you are doing physically. Work with the breath because the breath connects you with the external world. The breath is the medium that connects the internal and external world. Nothing else connects it the way the breath connects it. Then work with your mind. Try to develop that witnessing attitude where you can observe yourself without identification, without condemnation, and without justification. All of this is part of sadhana. So it is not just whether you stand on your head for 2 hours a day, but what is it that you bring to every moment of your life becomes your sadhana. And this is why this idea that, a modern medical doctor can prescribe a drug that they have never taken. They can suggest a diagnostic test that they have not undergone. But a yoga therapist cannot do that. A yoga therapist must have practiced that technique, understood the experience of that technique before giving it to somebody else. So it is not just, I read a book and this technique was there, I picked it up off YouTube and I'm going to try it for someone. No, you do it first. You taste the experience, the rasa. That's why we call anubhava is experience, rasa is the taste. Rasanubhava. You experience what happens in that technique and then share it with the other person because you will then be able to guide them. A yoga therapist is a mentor, is a guide. How can you mentor and guide if you have not had that experience? And that is why if we do not have our own sadhana of whatever form, it may be mantra sadhana, it may be japa, it may be meditational practice. I don't care what suits you, what suits your temperament, what is it that you need to manifest the best version of yourself. But make sure you are doing your sadhana. Because if you are not doing your sadhana, please change your career to something else. Don't be a yoga therapist.
Absolutely. 100%.
Thank you for that. I think it's a very good reminder for all of us and a very, very important point that you can't learn something theoretically and then offer it in yoga therapy.
Or have a research done that says this and this and this, and therefore I will use it to my client.
Right.
Doesn't work.
Whew. We have some tough things to figure out because we are trying to work within the medical system, provide evidence, and yet I think we all know that that doesn't capture the essence of what yoga and yoga therapy is. So it's a bit, we have to sort of play both sides a little bit, right?
Exactly. This is why I've shared in the chat box some of the publications we have on our website. And you will see more than 200 publications in the last 15 years that are there for people to read, to share We have the first volume is 76 publications. Now the second volume has another 74 coming out when the LMU team is here. Chris Chappell will be releasing that edition. So you give them the evidence. We are not hiding from evidence. We are sharing the evidence, but along with that, the experience. So evidence plus experience gives exuberance.
Wow, amazing. Thank you for the resources. I want to ask one more question. Excuse me. Sorry about that. I think it's a very important point that you make in your book about a change in paradigm from approaching health and healing from pathogenesis to salutogenesis. I think this is one of the main messages in the book. Can you just explain a little bit about this so we understand more what you mean?
Yeah. You see, pathogenesis. Genesis means to give birth. So, what are the factors that give birth to disease? That is pathogenesis. So, a fixation on disease, causation of disease, prevention of disease, mitigation of disease, rehabilitation of disease, and you are just focusing on it all the time. Nose in the mud of disease, pathogenesis. Salutogenesis, salus, which comes from our Latin wellness, health, and genesis, the factors that give birth to it. What are the factors that give birth to health and wellness? Changing the focus from illness to wellness. And when we talk about salutogenesis, it is not just, eat well, exercise well, sleep well. It is not just that. It is the development of resources that can help you resist the omnipresent stress. And in fact, Antonovsky, who is the father of salutogenesis, and his son who continues the work, Aaron Antonovsky is the father of salutogenesis, and Avishai Antonovsky, who continues the work in Israel, and are part of our mentor team at our institute, have emphasized salutogenesis is the building up of resources that will support you. They are called resistance resources. So you want to develop generalized resistance to the stresses. And then some people have specific stress for which you need specific resources. And how I am postulating this is yoga in general. The general practice of yoga is a generalized resistance resource. But yoga as a therapy is a specific resistance resource for that individual. And the heart of salutogenesis is a sense of coherence. Coherence is to make sense.
Just a minute. I just want to reiterate the point you made, that is a resistance for the person, not for the disease.
Absolutely.
Right? That's the whole point.
Absolutely.
Sorry, go ahead.
Yeah. See, it is like you are walking through a forest filled with thorns. You can either choose to pick up each and every thorn in the forest and spend your life focused on thorn picking, excellence, okay? Or wear a good pair of shoes and walk through the forest and not have the thorns impact you negatively. Life is like that. Life, people want a bed of roses. Every rose has 20 thorns with it. So if you have a bed of 100 roses, that is 100 into 20 thorns in bed with you. Okay? Thorns are going to be there. Stresses are going to be there. It is omnipresent. Every living being will be faced by stresses either externally or internally, either real or imaginary. You cannot wish it away. So what do? develop your resistance to it. Develop the resources that can support you, like the shoe, like the backpack, like the levitational practices that you can levitate and, skate through it if you want. But the sense of coherence is fundamental to salutogenesis. And the sense of coherence is based on three factors. Can you understand your life, your world? It is a comprehension. Can you comprehend and understand your life and your world? The second part is a coping skill. Can you manage your world and your life? So can you understand it? Can you manage it? And the third, which I feel is the most important, can you find purpose in it? Because if you can understand your life, what is happening to you, if you can manage it, and if you can find purpose in it, you have a strong SOC, sense of coherence, and salutogenesis is manifesting. Now, most of us have a sense of incoherence. We do not feel we understand our life at all. We do not feel we can manage it at all. And we feel it has no purpose at all. Now, moving from that state, incoherence, to a state of coherence is what yoga can provide easily. And again we are finding this. And again, this is not just for people who are having health challenges. It is for healthy people. It is for people who have health challenges. It can be for children. It can be for adults. It can be for the elderly. It can be during pregnancy. It can be during palliative, terminal life situations also. Because every one of us wants to understand our life, our world. Every one of us wants to have skills, competencies to manage it. And every one of us wants to find purpose in our very existence. Well, this is what we are doing in our institute, the only institute in India for salutogenesis. And whenever the Stars Society in Switzerland has an event, they put a small pin in India and say, we have the Institute of Salutogenesis down there in Pondicherry.
Wow.
I wanted to also address, if I may, the question that Anne is posing, saying, is salutogenesis an approach for end of life? Absolutely. I had a gentleman at the retreat, which came at the end stage of lymphoma. That was lymphoma. And I wrote about this. This is in your book. The way that it transformed his psyche and his whole view on life lived so far was just miraculous. He came in full of guilt and regret, and it was really difficult to see his suffering. And in 3 weeks, he turned his attitude towards whatever the life was. His fear of death was completely gone. He gained his internal peace and acceptance of the fact that nobody's going to help him anymore, that this is the end of life, and that he's going to live this end of life the best he can. And he left 3 weeks retreat in complete peace. And he died, I think 3 weeks later, he died in peace. So absolutely.
Thank you very much for clarifying that.
Yeah. In this situation, we are not talking about we're talking about healing, but healing does not mean curing, right? Healing does not necessarily mean curing, but he left healed completely.
I think the distinction here is very vital. What Lee has brought out is most of our pathogenic approach is based on curing. We want to find a cure which is a once and all solution. But healing is a process. Curing is an outcome, and we are always looking at outcomes. The process of healing is enabling the person to once again feel wholesome. Because when you have a disease, when you have an illness, when you have a trauma, you lose that sense of wholesomeness and you break down into pieces. We often use it in language. We say, my life has gone to pieces. I have gone to pieces. My relationship has gone to pieces. Yes, we have become piecemeal. We have lost that wholesomeness. I call it Purnam, which means completeness. And I talk about communicating salutogenesis in clinical setting through Purnam. We want wholesomeness. So to heal is to once again regain the sense of wholesomeness, that I am wholesome, even if the disease process is still continuing in me. But I am wholesome.
Yeah.
And that is why they can be together. You can be cured and healed also. You can be cured without healing, and you can have healing without cure. And healing without cure is often what many people in terminal conditions need.
Yes.
Because you cannot stop death. Everyone who's born has to die. But can we give them dignity in death? Can we give them peace in death? Can we give them a sense of wholesomeness in death? That is healing.
Absolutely. And this is, may I say that this is where our foot in the door comes in, specifically in hospices. Not only that, also hospitals recognize, or medical profession recognizes, the importance of spirituality in healing and in curing. And they meaning medical professionals, do not have knowledge, nor do they have the time to deal with spiritual issues. So there is a chaplaincy usually within the bigger organization or bigger hospitals, but there is many smaller hospitals which do not have chaplains. And if we do our own sadhana, if we expand our own spirituality and understanding of spirituality, and if we lift ourselves through sadhana, we can go to the hospital and help these people. This is where our opportunity lies. But we have to start talking about, when I started to talk about spirituality within IOIT, I was shut down for a year. And I didn't listen. And I started to talk again and then again and again. And finally, there is a group of people now within IOIT that has the evening of spirituality at Sitar. And so the more we talk about it, the more we accept that part of our own development includes our own development of spirituality. Therefore, only then we can go into the hospitals and offer that as a counseling, as a yoga therapy. And I do have, sorry.
Yeah.
No, you go ahead, because you speak much better.
No, I was actually enjoying the point you brought out that, the palliative setting, hospice setting is often neglected by many of us. That is a very, very good place for yoga therapy to really, really enter and can offer so much. Our yoga therapy, in those days it was a center, now it is a school, was next to the palliative ward. And I remember so many times our therapists would spend time with the patients admitted in the terminal and palliative settings. And so often after somebody left the body, the family would come and meet us and thank us that somebody was there with their mother, father, grandmother, uncle, aunt, and they would say, you being there with them, your presence enabled them to leave the body in such a good state that would not have happened otherwise. So the presence of yoga therapists, it's not what did you teach them left nostril or right nostril or head turning or arm turning. That is immaterial. Your presence is the therapy. And people, that is a place nobody wants to go. If you go in there, you will make a mark. And that difference will also make you feel you have done something to serve humanity.
Right. I wanted also to address Lisa's sharing where my perspective is that healing may also include getting in touch with difficult emotions. Absolutely. This is what Harry worked out. He worked out his fear of death, his guilt feelings, his sense of wasted life, his sense of not being who he wanted to be. He had worked it out all in 3 weeks, doing 6 hours of yoga every day. And when he worked it out, then came the peace. So it doesn't come, it doesn't come just peace is lovely, but what about the other stuff? The other stuff has to be taken care of first before peace comes in.
Right. You can't bypass the difficult emotions and feelings. We have to walk through the mud, but ultimately he found some peace, even though he had those difficult feelings. I read his story in the book, so I highly recommend reading the book. So we're coming to the end of our talk together. I think we can talk for 3 more hours. There's so much to be said, and I've enjoyed it so much. I just want to see if you would like to share with the audience before we open it for questions. We will open it for questions, and I'll turn off the recording. But where can they find you or practice with you? What's next for you, and how can people stay in touch with you?
Well, all you have to do
Silence.
I'm waiting for Ananda.
all you have to do is type Bhavanani and yoga in your search engine, and you'll find out how to be in contact with me, because there is no other Bhavanani in yoga in the whole world. Bhavananis are Sindhis. They are normally in education and business. None of them get into yoga. So I am blessed with a surname that is not shared by anybody else in the field of yoga in the whole world. So it's very easy. Bhavanani, there are a lot of Anandas. There are a few Balayogis, but no Bhavananis in yoga. And we do a lot of online, hybrid, in-person training programs, because after COVID, I realized the power of online training. And I have a very dedicated group of students where we are able to create that space that Lee has talked about. Even if it is not in person, we still come very, very close to it, because when you can bring people into that space, it can happen. It doesn't often happen, especially in sessions where I have been in conferences where I'm talking to my computer because nobody else has their videos on. Now that is totally dehumanizing. But when you have videos on, when people are practicing together, when you are sharing the experiences together, you can come close to what I call the Zoom womb. It's like a womb of the mother. So we call it the Zoom womb. And in the last 5 years plus, I have seen that. But then we give people an opportunity to come and study with us, and when they come and practice in the ashram, there's nothing like it. Because the presence, the atmosphere, the fact that thousands of people have done the sadhana in that place before you, that energy changes the way you experience the practice. But for those who cannot travel to India, there are online programs. If you can come for short time, there are hybrid. And if you can come for longer times, 3-month internship for yoga therapists in our hospital, where you can really get hands-on experience and see the type of work we are doing firsthand. So lot of good opportunities.
And I've put my email and my website on the chat if you want to contact me and see what I'm doing.
And amazing. Thank you. So I will just turn off the recording.
Was there going to be a last practice, Rachel?
Oh, yes. Oh, my goodness. I forgot about that. There will be a last practice. Ananda is going to be leading us
Yeah, last
in a
practice
final
sounds
practice.
like Last Supper. I hope it's not.
Not last practice, our concluding practice for this evening, um, or for this afternoon, wherever you're logging in from. Yes, we will do that now. Thank you for reminding me, and then I will stop the recording, and then we'll open it for questions.
Yeah. I would just like to share a very beautiful practice from our tradition that utilizes the power of nada or sound vibration. And I think I would say that 100% of our care seekers are given this technique because the pranava, the sound of a, u, and m, this a, u, ma, this combination connects us to the cosmos. And the moment you have that connection with something bigger, the healing process is facilitated. And you go out of this I, which is illness, to the V, which is wellness. And the pranava does it amazingly. Now, there are many ways it can be done, but what we are going to do is we are going to make a deep breath, and following the deep breath, we are going to be making 3 rounds of the sound of it's a nice guttural sound. Then we'll make the sound of oo, for which you need to pucker up the lips. Oo. And then the third is the mm. And then 3 rounds of bringing it together as Now this can be done with mudras, it can be done in different things. But I thought it would be just nice to have that experience. And I hope my Zoom settings were okay that you could hear the sound being made, because sometimes Zoom cuts off continuous sounds at the end of it. So you can just take up a well-aligned position where your spine, your lower, middle and upper back, head, neck are aligned. And just start to focus on your own breathing process. Breathing out first to empty the lungs. Breathing in the lower chest. And breathing out with the sound. Again, breathing into the lower part of the chest. A third round, breathing in. Now focusing on the mid part of the lungs, the middle chest region as you breathe in. And breathing out with the sound breathing in. focus to the upper part of the lungs and letting the mind be focused there as you breathe in. And breathing out with the sound of breathing in. Once more, breathing in. Now breathing into the lower, mid and upper parts of the lungs and bringing all the three sounds together as you breathe out. So breathing in. Breathing in to the lower, mid and upper parts of the lungs. Final round, breathing in. Sitting quietly, just enjoy the vibrations that have been generated from within. And ready, slowly coming back to the alert state, and if you want to rub your palms together, you can rub them, placing the warmth of the palms over the eyes, blinking into it. And then slowly bringing your hands down to your lap as you come back to the external light. This pranayama, can be a beautiful practice with the mudras, can be done from the lying down as a relaxation, and is amazing to just bring the stress levels down, enable a beautiful sense of quietude and deep connection.
Thank you.